Are you curious about the GLP-1 side effects? Well, I'm here to present you the top 5 most common side effects with GLP-1 treatment. Hope you're doing well. Josh Peterson, family nurse practitioner with Zip Medical. Starting at number 1, we have nausea. This is due to the delayed gastric emptying, where food is going to sit in your stomach longer and take longer to process. Also, there's an increased Glarent effect, so you're going to have more satiety or fullness sensation around your stomach, which can produce nausea. To help with nausea, we recommend smaller and more frequent meals. Avoiding high-fat, greasy, or spicy foods can help as well. Staying well hydrated is also very important, so you need to drink lots of water during treatment. If your nausea is too significant, you could ask your medical provider, like me, to prescribe a medication called Zofran, which helps with nausea. At number 2, we have constipation and diarrhea. Because of the delayed gastric emptying and the changes going on in your GI system, diarrhea and constipation are both pretty common in treatment. You probably see more constipation than you do diarrhea. For constipation, it's very important that you stick to a high fiber, high protein diet. Fiber helps bulk your stools and keep them soft, and you need to drink lots of water to keep your poop soft. On the flip side, if you're having diarrhea, you can use bulking agents like Metamucil or other agents that may help bulk your poop. And high fiber diet is again recommended. The third most common side effect that we see is heartburn or acid reflux. Again, because of that delayed gastric emptying, food's gonna sit in your stomach longer. Therefore, it may precipitate acid reflux or heartburn. And going back to the food choices, it's very important that we stay away from too much spicy, greasy, or fatty foods, because this could precipitate those symptoms. Eating smaller meals and not eating too late before lying flat can also be beneficial, so it is definitely not recommended to eat a late night snack or dinner before you go to bed. Other foods that can cause heartburn, acid reflux: chocolate, soda, caffeine, spicy foods like we said. The fourth common side effect that you may see is vomiting. If your dose is too high, that may induce you to have too much nausea and potentially make you vomit. At Zip, we recommend staying on the lowest effective dose possible, so vomiting is not very common with a lot of our patients. So for my patients, they do really well and typically don't have any episodes of vomiting. The last side effect that you may experience is fatigue or low energy. Because the medications are so effective, you're probably going to be in a calorie deficit. And when you have a significant change in the amount of calories you're consuming and sugar and carbs, that could cause you to feel fatigued. Now, I always go back to the food sources and how food affects your mood and your energy levels. And again, food choices are very important here. Now, although we want to stay on a lower carb diet, good sugars are very important when you have low energy levels. So keeping a simple fruit like a banana, an apple, or something like that on hand will help give you some energy and get you through the day. Typically, the fatigue and low energy levels will subside throughout treatment, but at first it may be pretty significant. If you have any questions on GLP-1 treatment or curious about Zip, shoot me a DM or visit our website at zipmed.com. Have a great day.